Hello and welcome to Star Wrap, the Art of Tissue Transformation. My name is Tate Yoder and I'm going to be your guide on this journey of unlocking the secrets of your fascia. So this is going to be an exploration guiding you through the ankle, knee, wrist, elbow, knees, hips, lower back, spine, and upper shoulders. And the idea is to unlock your fascia. So what is fascia? Fascia it's a connective tissue that wraps around every muscle spindle, muscle fiber, muscle group, every organ, everything in your system is wrapped by fascia. And what it is it's called the neuromyofascial web. So there's 10 times more nerve endings in fascia than in your muscles. So that means the communication from your nervous system to your muscular system is responsive, and you're more in tune to that communication when you're tuned into your fascia. So when you look at athletes, you look at performance, you look at just movement, grace, and ballet and dance, it's an awareness of your body, and that awareness comes from tuning into how does your foot and ankle communicate to your knee, communicate to your hip, up your spine. It's also called the kinetic chain and strength and conditioning circles. So we're really going to begin exploring how to move your bones, and we're going to show you each of the bones related to the area we're working. How do you get the bones to interact in a new way and in a new dialogue and have a new conversation with each other? Because if you can begin to have those bones articulate and move in new ways, the muscles that attach to those bones are going to be challenged out of their repetitive movement. So first we have to tune in to where your repetitive movements are and what that pattern looks like throughout your whole system. And then we get to unwind it. And that starts with high repetition movements, because high repetition creates more blood flow. And so we're breaking the pattern through high repetition movements where we're moving in a new way and without pain. That's a very crucial point. So we don't want to take you into any pain at all through this movement system. So I want to get started right away. These are expert strategies. I've been working with the body for 25 years. I understand how fascia works. I'm trained as a structural integration therapist, which is like a rolfer. I've been in strength and conditioning my whole life. So this is working with professional athletes. This is helping people out of pain. So applying this methodology is going to really help you tune into what's going on in your body and give you some very powerful strategies to unwind them and to relax them. So I'm so happy you've joined me here on this journey. I'm ready to get started. We're going to do a little bit of a breakdown of the content. So we're going to get into 3 concepts. The first step is unlocking the secrets of fascia, which I just covered that step with the movement of the bones. So the 3 concepts are intensity, duration, and frequency. So we're going to explore what that looks like, because each of you are different. You're going to have different levels of mobility. Your tissue is going to respond differently to what we're doing. And this is going to lead us into the strategies of the physio ball and the star stack method, where we're actually going to target those areas that we're identifying now and teach you how to release them through direct pressure and use of the star stack. So here's the star stacks. We've got the specific and the linear star stacks, so we're going to get into those in the next video. But then we're going to get into ankles, knees, hips, low back, spine, shoulders. So here we go. When you're wanting something different and something that you've never had, you need to do something you've never done. So we're going to be moving in new ways, in different ways. We're going to explore what each of the joints movement possibility is, with flexion, extension, inversion, eversion, rotation. Every joint has a specific movement that it can do, and what we're going to do is explore combinations of those movements to really isolate those fibers and restrictions in your body. So that's the step 1, unlocking the secrets of the fascia, high repetition movements without pain. So the intensity, as we get into intensity, I want you to just think about when you get into a stretch, if you go too quickly, it's going to be painful. Okay, so stretching becomes something you don't want to do because it hurts. So this is an enjoyable process. We're just wanting to get you to tune in at the most gentle level of what your range is, and then through the high repetition, that tissue begins to open up and the body says, okay, go deeper. You don't tell the body to go deeper. So that's a very big distinction, is what is your body allowing you to do and how to work with your body to get it to adapt to what you're asking of it, because it'll adapt to whatever you want. It's called the SAID principle, specific adaptation to impose demand. So we're going to ask something different and the body will adapt. So the duration is how much time you're spending in any of these positions, because it's really a therapeutic process here. So we don't want to rush it. This is your time. We want you to honor it. We want to honor how the body works. You have to be patient with the body. You can't force it. So it might take longer. So I invite you to spend some more time unwinding. When you find areas that are problematic, just pause the video and really get into exploring at whatever level, whatever depth is appropriate, which is some of the concepts we're going to be explaining and getting into. But spend some time listening to your body, and I will be guiding you, but this is to try to understand your body, and I'm communicating to you through this media, so I can't see you. That's the one-on-one sessions that I can do where we can really explore what's going on with your body. But right now, I'm guiding you. The frequency is just making this a habit. So instead of standing still, which is what we do, or sitting still, the physio ball is something that I use just to illustrate the point of oscillating movements, because our bodies are 60-70% water, so they're fluid. So we want to be fluid with our movements. I'm not standing still now. It's little oscillations which gets your body to adapt to that stimulus. So instead of being still and stagnant, what happens with stagnant water? It gets toxic. So we want to be fluid. That fluidity helps flush toxins, helps the muscle fibers floss and gloss, and helps the fascia go from a viscous or a gel-like state to a more viscous state. That's called thixotrophy. So we're getting that fascia to actually melt and become more fluid, which is where we get the responsiveness of your entire system. Okay, so here we go. It's time to close off the rest of your world, close down your laptop, unless you're watching this on your laptop. Close down your any other distractions. Try to find a nice peaceful space, and this is your time to tune into your body. So let's try to honor it with the peace and quiet, and begin with 3 deep breaths. So the idea with it's called box breathing. So we're going to take an inhalation, and it can be a 3-second, 4-second, 7-second, whatever your breathing rate is. You're going to inhale, then you're going to hold it for that same amount of time, and then you're going to exhale that same 7, 3, 4, 5 seconds, and then you're going to expel and squeeze for that 7 seconds, get all that oxygen out of your system. We're going to do that 3 times, so it's called box breathing. So here we go. Inhale through your nose, exhale through your mouth. Inhale. Exhale. And squeeze. Okay, and really focus on filling up your lungs, getting your ribs to expand, getting the oxygen to your chest. Okay, so start with your belly. Inhale. Hold. Exhale. And expel. Okay, nice deep breath. This is helping tune into your nervous system, so it's really beginning to calm you down and get you focused on your breath. So last one, inhale. Hold. Exhale. And expel. Okay, next is unlocking your spine. So we've been working up the entire chain, ankles, knees, hips, lower back, getting in the spine, and we're really beginning to articulate the entire vertebrae into our neck and shoulders. So that's finishing up the unwinding. So as we get into these next movements, we're really trying to think how the energy is coming out of the ground up our entire system and how fluid we can make that communication. So it's an oscillating vibration and movement up your entire structure, and noticing what you notice within that movement. So if we have any restrictions that we haven't identified yet, start paying attention to where those are, because we can go back in and target those through high repetition movements and without pain. So the vertebrae, we have the 7 cervical vertebrae, the 12 thoracic, and the 5 lumbar. Then you have your head and your sacrum, and the ilium and the ischium, so all the bones of the pelvis. So that's our spine. It's our center of our whole experience of life from birth. It's called your soma. So it's where everything that you've ever experienced in life is stored within your soma. It's your nervous system, it's your intelligence, your spinal cord, and your brain. So there's a lot that can be going on here. There's a lot of restrictions. There's work that I've been trained in called spinal reflex therapy that gets into the vertebrae that are actually caught in a reflex, so they're being held out of position by specific anatomy. So there can be so much going on with the spine, like I talked about with the lumbar, disc, bulging disc, herniated disc, slip disc, any kind of issue with compression. So be gentle. If you notice any pain, I want you to back off. Don't go into any painful movement. But I do want you to explore what is going on around any pain and begin touching on small little movements to see if we can wake up that area that's restricted or inflamed. But if the pain starts going up, then back off and lessen the amount of stress we're putting into that area of your spine. Okay, so we started with the lateral bends, just with pushing the hand down and stretching that hand over top. So what we're going to do is work on how much we can create an oscillation from our feet all the way up our spine laterally. Okay, so we can reach down towards our feet, get our hands and head hanging laterally, kind of articulate that stretch. Okay, so wherever this is, whatever that feels like, getting that whole lateral line isolated. Nice gentle rocks, and then noticing as we come out from the ankle up the hip, up into that lower back, up into the ribs. What do we feel? So as we're down, we come up, and what do you notice in that whole chain from the foot and ankle all the way up? If there's any restriction, explore it. Okay, same thing to the other side. Holding a dangling position laterally, noticing what's going on in the hip, noticing what's going on in the lower back, bringing that kind of that stacking of the vertebrae laterally. So lifting one vertebrae at a time, rotating. What do you notice in that movement as we come up and isolate and identify that whole unlocking of that lateral line? So back and forth, we've got the forward, flexion, extension. All right, so we've got rolling your head down, coming back up. It's kind of a wave of energy down and up. And then we've got, you can do a little variation to the lateral bend. So you can take one foot over, cross my left foot over my right, shift to my right. Think about the position of your feet now. So you can be on, the heel, the toe. What kind of destabilization can you do now? Because now we're balancing on, maybe the knife edge on both feet. So just those 2 points of contact. As we go lateral, okay, what kind of movement and stretch can you feel? And it's gentle, Okay, so we're not trying to force any kind of a movement. We're going nice and gentle and then coming back up. Okay, so cross the feet, balance on the knife edge, bend laterally, come down as far as comfortable, and then really isolate that left side. If I'm stretching to my right, cross over, do it to the other side, bend down, work on your balance, and then activate that lateral side on the right. Okay, and notice what's going on. All in that rib, and those ribs and the hip. What do you notice? And this can be done, 25 times. Whatever your range is, be gentle. So if it's here, wherever it is, just do small little reps, activating that whole lateral line. Okay, so 25 reps, nice and gentle, destabilized. And then, the more intense you want to make it, stretch those hands out, keep that engage isometric contraction, so engage that stretch, and then come up. So you can do that both sides, explore what's going on in the lateral line. You can also do it with flexion extension, so you can grab your toes, you can have your knees bent, you can flex and extend, working on the hamstrings, keeping the spine neutral, or you can engage the spine and look up and flex and extend. Okay, so you can look to the left, flex and extend, look to the right, flex and extend. Working on that back line as we're rotating and shifting our upper torso. Keeping our head down, flexing and extending. And then you can go back to that gentle wave, getting that hip and shoulder, the neutral spine, communicating and unwinding. Okay, so now we're basically really working on, we've got the entire structure from the ankles up to the spine opened up. So now we're going to start getting into the shoulders a little bit, neck and shoulders. So we've got how we've brought the spine into flexion extension. We've gotten the shoulders involved with that rotations, with the lateral bends. So now we're going to get into what the neck and shoulder looks like when it connects to the rest of the spine. So there's a lot of tension within our neck and shoulders. So this is the final piece that is going to hopefully connect the entire chain and your fascial pattern. So you've been tuning into where you're carrying tension, where is the restriction, and what we can do to target and isolate that area. So we're moving into the next and final piece of unlocking the neck and shoulders.